My name is Hina Mazharuddin. I'm a practicing PA and the Vice President for PAs in Virtual Medicine and Telemedicine. Today, I'm going to walk you through how to conduct a basic physical exam on a patient through a virtual platform. It might feel a bit unusual at first, but no worries, your training has prepared you well. Now, let's see a patient. Here we have Miss Jones, who is 41 years old. Her height is 5 feet 3 inches, and she weighs 160 pounds. Her past medical history is significant for hyperlipidemia and hypertension. She's had her gallbladder removed in 2018. Her medications are as follows: amlodipine for hypertension, atorvastatin for hyperlipidemia, and zolpidem for insomnia. She has no known allergies. She presents today with the chief complaint of right shoulder pain for 4 weeks. Let's start the visit. Hi, Miss Jones. My name is Hina, and I'm the PA that will be seeing you today for your appointment. How are you doing today?
I'm okay. It's my shoulder. It's been hurting me.
Oh, I'm so sorry to hear that your shoulder is bothering you. Let's work together to figure something out for that. But before we get started, may I first get your location and telephone number, please?
I'm currently at 1234 Main Street, San Diego, California, and my phone number is 619-555-0123.
As you know, we're going to be doing a virtual visit today. Have you ever done one of these before?
I did use Zoom for a parent-teacher conference once since the pandemic, but I've never seen a medical provider this way.
That's okay. Just so you're aware, let me give you a brief overview. Telemedicine is a great tool that we can use to help connect with our patients, but it does have some limitations. Obviously, I'm not physically there with you to conduct a physical exam, but no worries, we can still work together to get a good history and physical exam done for our assessment. Just like in the office, everything we talk about is still held to the same HIPAA standards, and we are connected today over a secure HIPAA-compliant video conferencing account. Just so you know, I have 2 screens up for today's visit, so I can see you and chart at the same time. You may see me looking over this way. It's just because I'm toggling between 2 screens. Can you see and hear me okay?
Yes, I can see and hear you just fine.
Great. Do I have your consent to start?
Sure, go ahead.
Thank you. Let's start by obtaining some vitals first. We can still do this on a telemedicine visit. Do you have any tools at home, like a thermometer or a blood pressure cuff?
Yes, I have a thermometer in the bathroom and an automatic blood pressure monitor. Is that okay? I used them before the call because I figured you might ask. My temperature is 97.7 and my blood pressure is 123/82.
Thank you. I've recorded that information in your chart. So I understand that it's your shoulder that's troubling you. Can you tell me a little bit more about that, please?
It started a few weeks ago. I had to move to a new apartment and I must have twisted something when lifting the boxes around.
And which shoulder is it, please? Can you point to it?
It's my right shoulder.
So you've been experiencing some shoulder pain on your right side.
Yes.
Did the pain come on quickly or was it more gradual?
It was a little sore at first, but it has gradually gotten worse over time.
Is the pain limited to just the shoulder or does it radiate?
No, it's not radiating. It's hurting right here.
Is this a new pain or have you experienced something like this before?
This is a new pain since it started 4 weeks ago after I moved. I haven't had any shoulder pain before that.
Is the pain constant or does it come and go?
I don't notice it all the time. It mainly bothers me when I try to comb my hair or reach for something in a cabinet.
And what are you currently doing to help manage the pain? Does anything make it better?
Sometimes Tylenol or ibuprofen helps, or a heating pad, but not for very long. Sometimes I'll use marijuana since it's legal here. That seems to help a little, mostly just to take my mind off of it and help me sleep.
Does anything make it worse?
Sleeping on that side at night makes it worse, so I haven't been sleeping on that side at all.
Can you describe what the pain is like? Is it a tingling, burning, or throbbing kind of pain?
It feels like a dull ache.
And on a scale of 1 to 10, can you please rate the pain, with 10 being the worst pain that you've ever felt?
It feels like a 2 when I'm not doing anything, but it can be up to a 7 or an 8 if I'm trying to use it, like I said earlier.
Are you experiencing any other symptoms?
No, I don't think so. But I am concerned because the pain has been bothering me for a while now.
If you feel comfortable, can you please remove your sweater so I can take a better look at your shoulder, please? And can you move a little closer to the camera so I may see your shoulder? What I'm looking for here is any asymmetry, swelling, redness, rashes, or bruising. I'm going to be looking over here so I can get a better visual.
Okay.
Thank you. Next, we're going to do some palpation. Can you please press on your shoulder? And now towards the back of your shoulder blade. And now on the collarbone, please. Any pain or discomfort?
No.
Now let's test your range of motion. Don't worry, I'll do it with you. If you could please lift your arms all the way up, please. Good. Now give yourself a hug. Good. Lift your arms all the way up, but forward this time. Great. And now go ahead and put your arms behind you like this. Great. Now I'm going to ask you to flex your elbows at 90 degrees like this, and then go ahead and rotate out. Good. And now to the back, kind of like you're scratching your mid-back. All right, great range of motion. I can tell that hurts a bit, especially when we get towards the top and towards that end of range of motion. Now we're going to do some special tests to see if we can better identify the cause of the pain. First, we're going to look for impingement. That means the tendons that make up the shoulder, they have to cross underneath the bone and may actually be getting squeezed. So we're going to work together for this one again. Once again, please slowly bring your arms all the way up and tell me when you feel any pain or discomfort, please.
Like there.
Okay, now I'm going to ask you to put your arm out like this and make kind of like an upside down L. And then with your hand, push backwards. Both of those tests were to see if the tendons were inflamed. Now put your arm out like this and make a thumbs down sign. And then with your good hand, put it across this way, please, and push down. Okay. Now I want you to pretend that you're holding 2 cans of soda and then pour them out, please. That's testing the supraspinatus muscle. Next, I'm going to ask you to hold your arms out like this and then extend outwards. Good. That's testing for the other 2 muscles of the rotator cuff, the infraspinatus and teres minor. And lastly, I'm going to ask you to put your arms behind you like this and see if you can lift off. And that's testing for the final muscle of the rotator cuff, known as the subscapularis. Thank you so much, Ms. Jones. You've been great. I think we can now narrow down what's going on. Okay, so let's recap and put together what we just saw and what we've learned in PA school. During this exam, you may have noticed that we did the following. We started with inspection. We checked for any asymmetry, redness, swelling, or bruising. Next, we did palpation. We asked the patient to push on the clavicle, the AC joint, and all the major muscles of the shoulder. After that, we tested for range of motion. We tested abduction and adduction, forward flexion and extension, external rotation and internal rotation. We even did special tests. For impingement, we did the painful arc test, the Hawking's test, and the Neer's impingement test. We assessed for any weakness using things like the empty can test to test for the supraspinatus muscle. We test for fixed external rotation to assess the infraspinatus and teres minor muscles, and even did a back liftoff test, and that was to test for the subscapularis muscle of the rotator cuff. There are also a few specific things we did during this encounter that were helpful tips for telemedicine. Let's review. You heard me ask, may I first get your location and telephone number, please? Remember to always ask for 2 patient identifiers. In telemedicine, it can be helpful to know where the patient is located and get a good contact number, in case you get disconnected or need to call for higher level care or help. Remember to obtain consent before starting. This helps instill a sense of patient autonomy while also complying with ethical guidelines. You heard me ask, which shoulder is it, please? Can you point to it? On telemedicine platforms like Zoom, mirror imaging may be a problem. You heard me ask the patient to state which side of the body is hurting and show it to me, and that was to avoid any mirror image confusion. You may have heard me say to the patient, if you feel comfortable, can you please remove your sweater so I can see if there's any redness or swelling? What I'm looking for here is any asymmetry, swelling, redness, rashes, or bruising. In telemedicine, it's a good idea to explain what you're doing and why you're doing it. Very similar to what we're used to, OSCE style. You heard me reassure the patient. When I want the patient to do a particular motion, I'll often show them instead of just telling them what to do so that they can mirror me. I'll also reassure them. You heard me say, I know this may seem a bit silly, but don't worry, I'll do it with you. In telemedicine, I often coach and encourage them throughout. Great range of motion. I can see that hurt a bit, especially when we get towards the top and towards the end of that range of motion. Encourage the patient, but also acknowledge them and acknowledge their pain. Make them feel validated and show them that you are truly observing them and noticing even subtle things like the grimacing in their face. Remember, telemedicine can rely heavily on visualization. Also, explain things in a simple language. You heard me say, first we're going to look for impingement. That means the tendons that make up the shoulder have to cross underneath the bone and may be getting squeezed. You heard me say, we're going to work together for this one. Once again, reinforcing that team approach and that we're in this together. This allows you to build trust and rapport with your patients, despite being on a virtual platform. You heard me say, this is testing the supraspinatus muscle when doing special tests like the empty can test. Sometimes I will intentionally use medical terminology to explain to the patient what we're looking for, especially when we're doing something that may seem a bit silly. From a patient's point of view, emptying fake soda bottles is supposed to mean something? Actually, yes, it does. It lets me know how the supraspinatus muscle is doing. You heard me conclude with thanking the patient at the end, again emphasizing that team approach with the patient and showing them that collaboration and trust has been built. These are the same steps you would have taken if the visit had been in person. You may have to be a little bit more creative, but you already have the information that you need. Telemedicine can be a vital tool in the fight against prescription opioid misuse. By learning how to best provide care through all available platforms, you are helping to expand access to vulnerable populations and reduce the stigma associated with pain and pain management.